Hello, I'm Dr. Abena Krow-Rodney of the Family Practice Clinic. Welcome to Living Well. Colon cancer is the third most common diagnosed cancer in men and about the second most common diagnosed cancer in women. There are approximately globally 1.2 million cases of colon cancer found in 2008, and of those 1.2 million, over 600,000 of those people died. So it is a fairly serious disease. The United States has the highest survival rate from colorectal cancer, and this might be attributed to the intense screening that has been implemented over the years and the availability of resources for screening. About 61% of all patients treated for colon cancer survive about 5 years. This includes all different stages of colon cancer from stage 1 to stage 4. Colon cancer risk is increased by a lack of physical activity like exercise, excessive consumption of red meats, obesity, cigarette smoking, and excessive alcohol consumption. Other factors which increase your risk for colon cancer and require earlier surveillance are patients with a family history of genetic syndromes, which consists of multiple colonic polyps. Other factors which place individuals at increased risk for colon cancer include a personal history of colon cancer in the past or personal history of inflammatory bowel disease. These are diseases like Crohn's disease and ulcerative colitis. Some observational trials have shown that the use of aspirin and non-steroidal anti-inflammatory drugs have been shown to decrease risk of colon cancer. Some postmenopausal hormone use has also been shown to decrease risk. Multivitamins, folic acid, selenium, and consumption of vegetables, fruits, and increased fiber in diet. The mortality from colon cancer can be significantly reduced by early detection. And so colon cancer screening allows us to identify pre-malignant lesions, detect asymptomatic early stage malignancy, and inevitably these factors will help decrease mortality from colorectal cancer. Some patients present initially with complaints of abdominal pain, some with changes in their bowel habits like constipation and diarrhea, alternating bowel movements, weakness, anemia, and weight loss. Patients who have no risk factors are considered average risk patients, and it's recommended that they be screened for colon cancer from age 50 and beyond. We recommend that patients be screened up to 75 to 85 years of age or where the life expectancy is 10 years or more. The American College of Gastroenterology recommends initial screening to be at the age of 40 to 45 years of age for African Americans because of the increased risk of developing colon cancer in this ethnic group of people. There are multiple screening options which we have. Just for initial evaluation, some providers may choose to start with a fecal occult blood sample, which is just a stool sample placed on a piece of card, and this detects whether there are red blood cells in your stool. We'll usually do that with 3 stool samples. We also have other tests like colonoscopy, which is recommended for the average risk person to be done every 10 years after the age of 50. We also have other screening tests like the barium enema, which is like an x-ray, which you drink a contrast dye and the x-ray can take pictures of your colon tract. We also have a CAT scan, it's called CT colonography, but it's pretty much like a CAT scan with a video, which will be able to take pictures of your colon. We also have the flexible sigmoidoscopy, which is also like a camera at the end of a tube, which we pass in the rectum to see a short segment of your rectum and your sigmoid colon. If any of these tests turn out to be positive, we'll need to ultimately do colonoscopy, which allows complete visualization of the entire colon. Normally, most providers during your annual physical will check up on your screening to see when last you had your colon cancer screening based on your age. As I said, for people with average risk, which people with no family history of colon cancer or no first degree relative with adenomas or any of the syndromes, those people can be screened from the age of 50. African Americans now is recommend we screen from age 40 to 45. Thank you. This is Dr. Abena Krow-Rodney on Living Well.